And good evening, everyone. And welcome to this episode of the AskDrMJ, Your Health is Important, Facebook Live radio broadcast. We are here live in the studios of Atlanta West Primary Care. We have our producer and our showrunner, Mr. Haile Habib, who's going to be screening and asking your healthcare questions. So let's get to it. We know you have options, and with this daylight saving time of your health is important, we are here right now. Okay. So we got Dr. MJ Collier here live, and we are here to answer your healthcare questions. Thank you once again for joining us. I hope you have been listening. I hope you have been going to the YouTube channel and watching the videos. I hope you've been listening to the Wellness Wednesday broadcast on the Rickey Smiley Morning Show. And I hope you are, again, getting the health information that you need, because that is our mission. That is our passion. That is what we are here for. We want to make sure that you are getting everything that you can out of this broadcast. So we're going to start off again. I started off this morning on the Wellness Wednesday talking about this new, amazingly effective upper respiratory tract infection that seems to be taking everybody down and out. I'm suffering from it myself. You may hear that my voice is a little froggish. I am recuperating. I'm probably about 80% now. But this is the second week. Normally, the length for a respiratory tract infection, it usually will run its course in 7 to 10 days, no matter what you do. You don't have to do anything. But if you take your medications, the antihistamine, your Mucinex, your Robitussin, etc., you may be able to even shorten that to maybe 5 days. But in this circumstance, and the thing that everybody is sharing with me is that it's making them sicker, and it's lasting so long. It's making people have to miss work, which is highly unusual, because most of the time you can still get through it. Once you realize, or once you've been cleared that it's not COVID, you can work. Once you've been cleared that it's not the flu, you can work. As a matter of fact, the current and newly released CDC guidelines say that even if you test positive for COVID, unless you have a fever, you don't have to stay home. That you can isolate if you have a fever, but other than that, you can go out, you can wear a mask, you can do these things. So they are basically treating it as if it is a traditional respiratory tract infection. Now, this is a problem from the perspective of it's not a respiratory tract infection. We still have about 19,000 people infected per week, and we still have over 1,000 deaths per week across the U.S. From the coronavirus, and we're not seeing that type of virulence with the RSV or with the flu. Now, they say, one of the reasons that they are downgrading it, if you will, is that most people have had it, they've gotten over it, they have a natural immunity, or they've been immunized, or both. So even if they get sick, they won't be as sick, it won't last as long. So that is a truism, without question, that is indeed the case, and that is where we are with that situation. So if you have a cold, bronchitis, that's where the airways get irritated, you can't talk, you can't stop yourself from coughing when you lie down, particularly at night when you're trying to sleep. The coughing can be overwhelming, which now you're not only tired and fatigued from coughing, but you're sleep deprived as well. And I know that if you have someone in there with you, a sleep partner, a spouse, or significant other, then they're not too happy with the fact that you're coughing all night, because now you're keeping them up as well. And then they also don't want you to make them sick. So if you have a cold, it's been several days. The mucus was clear, because if it's clear, it's definitively, without question, a viral infection. And that mucus is a perfect growth environment, a swimming pool, if you will, for virus to grow. And it does. And that's why it takes about 7 to 10 days. It has to go through the viral life cycle. And then it lives, it thrives, and then it dies. It outgrows its potential. Well, if that sputum changes color about day 5, it was clear, now it's yellow, then dark yellow, then green or brown. That is an indication that the infection has gone from being viral to one that it is now bacterial. When that is the case, then you're going to need antibiotics before you can resolve this chest infection. And that is when a bronchitis, which is infection of the upper airways, the trachea, and the 2 branches, the bronchial tubes that go to each lung, it's a Y formation just at the point of the notch in your collar right there, between your collarbones. Your trachea breaks into two branches, left and right bronchus, and those become inflamed. The lining anyway becomes inflamed, and as long as it stays there, it just makes you cough and is irritating. But it can go down lower into your lungs and create a pneumonia situation. That is when you got a really big problem because you can't clear that mucus the way that you can when you cough and you have bronchitis. So, the treatment is, if it's bacteria, you need some antibiotics. If it's viral, you're going to need a mucolytic like Robitussin or Mucinex. Mucinex and Robitussin are the same medication. One is just a liquid form, one is a tablet form. And then a non-sedating antihistamine, Zyrtec, Claritin, Xyzal, or Allegra. Antibiotics if it's bacterial. And then rest. Stay hydrated. Very important that you keep that mucus from drying up and becoming thick. The thicker it is, the more difficult it is to expectorate it. So when it's thin and watery, it's easier to relieve yourself of that mucus burden. So that means requiring that you stay hydrated. And if you have a fever, you are losing over a liter of fluid during a certain period of time. So it's very important that you rehydrate, keep fluids coming in. And the preferred method is, of course, water. Water is better than anything else. Gatorade and Powerade will give you electrolytes, but if you don't have nausea, vomiting, or diarrhea, you don't need electrolytes. You just need fluid, and water is the perfect fluid for that. And so drink lots of it. These herbal teas are actually pretty good too. Teas with that you put honey. Tea with honey will coat your throat and help control your cough, as well as virtually any prescription medication or even the over-counter cough syrups. So there we go. So thank you for joining us tonight. Let's do our roll call, Havlet. Okay, Winnie King. Hello, Winnie. Thank you for joining us today. It's so good to hear from you once again. Sean Big Time Green, my man, repping Monroe, Louisiana. Sean, you the man, sir. What happened? Hello from Dallas, Texas. There we go. We are doing good. Deborah Bell from Jacksonville, Florida. Deborah, thank you for being with us today. Makiba Boland, thank you for joining us this evening as well, Miss Boland, great friend. Carla Mack. Hello, Carla. How are you? Sherry Gamble. Good evening, Sherry. Thank you so much for being with us. Teresa Thalley-Waters. Waters. Hello, everybody from Maryland. Carolyn Brown from Michigan. Hello, Carolyn. Ron Kreigler from St. Louis, Missouri. Ron, thank you so much for being another testosterone-laden male. We need more men. C.L. Turner from Baton Rouge. Thank you very much. Dana Woodruff Jr. Good evening. How are you? Thank you so much for tuning in. Good picture with that beautiful baby. Jordana Woodruff, good evening once again. We appreciate you for being here as well. Tracy Ligens from Oklahoma City. Tracy Ligens from Oklahoma City. We are so glad to see you as well. Loretta Young from Batesburg, Leesburg, South Carolina. First time here. Well, welcome, Loretta. We appreciate you. Ruby Holman from Armory, Mississippi. Okay. Angel Alexis from Chris, Atlanta. Hey, Chris, Atlanta. Okay. Hello from War Acres, Oklahoma. Now, that is the first. Lakeisha Hope, thank you so much for being with us tonight. All right, Jadena from Florida in the spot. You are correct about that. Okay. Shannon Roster Green from Birmingham, Alabama. Thank you. Maurice Williams from Chicago, Chi-Town in the house. Be Nice. Hello, Be Nice. Thank you so much for returning. We're so glad to have you as well. Okay. Carlos Cogburn, Swan Seal. Okay. Okay. Be Nice, Birmingham, Alabama. There you go. That's what we're going to hear. Lorraine Daniels from Maryland. Thank you, Lorraine, for joining us this evening. Mike Neville from Houston, Texas is in the house. Mike, thank you very much. Maurice Williams from Saginaw, Chicago. All right. Telia Starks from St. Louis, Missouri. Thank you, Telia, for joining us. We got the Midwest now. Juanita Evans from Indianapolis, Indiana. Thank you. Ayeza from Birmingham. Okay. Adrian H. from Dallas, Texas. Hi, Adrian. Thank you so much. Your first time as well. Thank you for being here tonight. You're on YouTube. Okay. Sherette Lewis from, she's on FaceTime from Florida. Rick Chatham from Rochester, New York. Thank you so much for joining us, Rick. I'm so glad to see we got so many men participating tonight. Kim Wilson from Cincinnati, Ohio. Used to spend my summers in Cincinnati. Allison Rubrosen. All right. First time as well. Thank you, Allison, for being here tonight. Okay, Heidi. Thank you so very much. And listen, for those who have not had an opportunity to visit our LipoDrops website, because we're always referring people saying, go to the website, lipodrops.com. So you can see things. One, we have the videos that you can actually access this broadcast through the website. There's a link, direct link that will do that. It also links you to the YouTube channel where you can see all of the videos that are there. But it gives you products and explanations and very elegant descriptions of what the product is, what it does, and how it would benefit you. So Heidi, can you put that up for us? I'm just going to show you what that looks like so you'll be able to join us. There we go. Okay. Okay, we are so glad that you had. Thank you, Heidi. We appreciate that. So you see, the website is active, it's lively, it allows you again to see this broadcast, and it is incredible the amount of information that's on there. Okay, so it tells you about all of our supplements for good health, our supplements for weight loss, and again, virtually any topic that Dr. Collier has spoken about, you can link through that site. So it's a wealth of information, and it will do an analysis for you if you would like to have that done as to your health issues, your weight loss goals and objectives, all of those things. So thank you so much for being here tonight. So you're in the show now, and it's your show. Thank you for joining us on this daylight savings time, first of the year broadcast of the Ask Dr. MJ, Your Health is Important radio broadcast. So let's see where we are now. Okay, Destiny Kearney, good evening. What is the best natural way to cure an over-acidic stomach? I've been suffering from chronic acid reflux and have been taking pantoprazole for a few years. Destiny, the answer to your question is on the website, lipodrops.com. To excess production of acid in the stomach can be due to a variety of factors. But one thing about it, when you have excess acid, it causes a change in the pH of your stomach, which causes a change in the bacteria, your gut flora in your entire GI tract. So when that turns to the bad bacteria that can survive in a higher acidic environment, it does a few things. It gives you very foul stools and it gives you very bad breath. In addition to that, it can literally eat away at the lining of your stomach. So one, you want to keep what's ever in you moving forward. So that's where our Lipo Cleanse product would come in. And two, our probiotics. Our probiotic product is literally God's gift to GI health. And so if you start to take both of those products, the Lipo Cleanse, which is not a laxative, the term cleanse has been co-opted now, and there's nothing in the store identifies itself as a laxative. They call themselves cleanses. The cleanse could be 1 day, 3 days, 7 days. But our product, Lipo Cleanse, is not a cleanse, but what it does is allow you to have large, easy to pass bowel movements that keeps your stomach flat, stops you from having excess gas, excess acid, and normalizes your GI function. So then you make sure that the predominant bacteria in your stomach is the good kind. You will notice after you have been taking it, probably by the third day, it's going to take a while to convert the bacteria, definitely no later than the first week, that all of a sudden your breath is better and it does not smell as foul in the morning when you wake up. You don't have that same dragon-like breath. And when you have a bowel movement, it's not going to be pleasant, but it's not going to be the kind where you tell people, okay, stay out of the bathroom for 30 minutes because, it's rough in there. And you will find this will change your life as far as your GI health is concerned. So Destiny, add those two things. I found that people are able to decrease those proton pump inhibitors like pantoprazole, or Protonix is the brand name for that product. And when you do that, some people are able to cut them out totally. Some people are able to cut down their usage. But one thing about it, if you're still having that excess acid production, then you're going to need to keep that acid level at a minimum. Other things that can help coat that, natural things that allow your stomach to digest. Crunchy fruits and vegetables are also very good to help with stomach acid as well. Eating any type of yogurt, but I recommend Greek style yogurt, any flavor. The reason why is because Greek style yogurt is basically the highest source of probiotics that you can get, other than our lipobiotics, of course. The thing about the lipobitic product is it's a capsule and it sits in a bottle in one bottle, and you got a month supply. With yogurt, you got to fill your refrigerator up. If you're eating 1 cup a day, that's 14 cups. That's a lot of refrigerator space. So it becomes a practical matter, particularly if you and say your partner are both taking the probiotics. And I recommend that everybody in the house takes the probiotics on a daily basis. Dr. Collier has what I call the physicians or Dr. Collier's essential. The essential trio is probiotics, omega-3 fish oil, and vitamin D. Everybody should take those things on a daily basis to improve your health. Great question, Destiny. We appreciate that. Winnie King from Terrell, Texas. Is it safe to take red yeast rice with your blood pressure medication? Yes, it is. You're on amlodipine, which is it's a calcium channel blocker. And what that does, and you're on a 5 milligram dose, it comes in 2.5, 5, and 10 milligram doses. The thing of 10 milligrams is very effective, but it usually makes people's ankles and feet swell. So most women in particular don't like it. The 5 milligrams rarely does that, and it does give you great blood pressure control. The way that this medication works, and it's one of my favorites, particularly in African-American men. Let's say you have a pipe that's this big, and you got a certain amount of fluid or blood in it. So that blood is on a certain amount of pressure. Well, amlodipine is a vasodilator, so it makes the pipe bigger. So you have a bigger pipe with the same amount of fluid, ergo less pressure. The benefit of that is the mechanism of erection is one of blood flow. So now that you have a bigger pipe, more blood flows into the penis, so it makes a man's erections longer and harder. I have never had a single patient complain about that side effect. It's technically a side effect of the medication, but men are always concerned and complaining about blood pressure medicine that may negatively impact their ability to function sexually. Last patient I saw today as a major concern, didn't want to take blood pressure medicine because they didn't want us to take the lead out of that pencil. Well, that's why I explained him the exact same explanation I just gave you. Amlodipine is amazingly good for that. Works effectively in men and women. That's just a side benefit for men that they get longer, harder erections. But it is perfectly compatible and safe to take with the red yeast rice as well as CoQ10. CoQ10 is a great supplement, particularly if you're also taking a statin class cholesterol lowering medication. That would be Lipitor or atorvastatin, Crestor or rosuvastatin, Zocor or simvastatin. These are the most common cholesterol lowering medications. All perfectly wonderful, all perfectly good, and Dr. Collier highly recommends lowering the cholesterol because you have the combination of high blood pressure and high cholesterol. That is the recipe that's necessary to have a heart attack or a stroke. So the recipe is being stirred, the cake is baking. If you have those things. So some people complain of things like muscle ache due to statin therapy, and CoQ10 is great for mitigating that side effect. And it also does a few other good things for you as well. So CoQ10 is a great supplement to take along with the red yeast rice. So you're doing great things to lower the cholesterol, Winnie. And then the amlodipine is great for the blood pressure as well. Great question. Sierra Witcher. Hello, Dr. Collier. What is the best allergy medication to take with head pressure, stuffiness, and shortness of breath, nasal drip? Okay, well, most allergy medications, particularly the non-sedating antihistamines, have the benefit of also acting as a decongestant, even though they technically are not decongestants. But they each and every one has a decongestant component. For Claritin, there's Claritin D. For Allegra D. So if you have a product that has the D after it, the D stands for decongestant. But that usually means also you can't just walk up to the counter and get it. You have to go behind the counter. And it's still over the counter. It doesn't require a prescription to get. And you ask the pharmacist for these medications. And the problem is they contain the most common decongestant is pseudoephedrine. Pseudoephedrine, for some sidewalk chemists, can be converted into methamphetamine. Most people do not have the capability to do that, of course. It's a complicated process, but there are people that do. And for those people that do, all the goods, so to speak, have to suffer with the few bad, because that's why it's not available over the counter. And you have to walk up and ask the pharmacist for it. And sometimes you have to produce your driver's license. They have to make you sign a form. So this is nothing unique to you. Do not feel like they're discriminating against you or anything like that. That's the way that it is. So if you want to get a product that has the D, there's a Mucinex DM, which contains dextromethorphan, which is an anti-cough component of the Mucinex. Mucinex proper is guaifenesin that breaks mucus up. It's a mucolytic. It makes thick mucus thin and watery so that you can cough it up and expectorate it with no problem. The D in Mucinex D is the decongestant formulation, and that has they can actively decongest your sinuses and your chest. And so some people will take, say, for instance, Mucinex D and then take Robitussin DM or any other cough syrup that has DM, because the D formulation does not anti-cough. So that will relieve your head pressure and stuffiness. Shortness of breath, hopefully, is not it could be a symptom of a severe bronchitis or even a pneumonia. So you have to be very careful about shortness of breath. Just having chest congestion is one thing. Shortness of breath is another whole monster and needs to be evaluated, particularly to rule out COVID. That is one of the signs and symptoms that you have a bad COVID infection. So one of the things that needs to be evaluated. Sarah, thank you so much. We appreciate you, Ms. Witcher. Lynn F., what supplements do you recommend for osteoarthritis of the knee? Osteoarthritis, anything that has itis, I-T-I-S, the last four letters. That means inflammation of, like appendicitis, inflammation of the appendix. Osteoarthritis means inflammation of your joints. Osteoarthritis causes inflammation but doesn't cause any substantive or significant joint destruction. Just makes the joints swell and hurt. Rheumatoid arthritis deforms the joints and also makes them swell and hurt. So you have edema, swelling of all those joints. Usually, most common is the knuckles of the hand. Usually, the knuckles that separate your hand and your fingers, the first two knuckles there, and then the knuckles here, here, and here. Osteo, rheumatoid, these knuckles, and the wrist. And so that's when you see people with wrist deformities, their fingers are floppy. That's rheumatoid arthritis. Osteoarthritis, inflammation. So the things that you can do to treat inflammatory conditions are use things that are anti-inflammatory in nature. Two things that come to mind immediately: vitamin D3 at a dose of 5,000 international units per day. That is the effective and therapeutic dose. Less than that is not going to give you any substantive benefit. The actual recommended dose, I think it's about 800 micrograms per day. That is totally and completely insufficient to obtain the benefits of vitamin D. So that's the FDA recommended dose. If you look on the counter, most of the capsules that they have or tablets are 1,000 milligrams. Then they started offering 2,000. Everyone now knows that 5,000 is the dose that you need. So 5,000 is available now. You will oftentimes see it on the counter. There are even some combinations, particularly with vitamin K. You'll see vitamin D3 and K at 10,000 international units daily dosing. So that is probably not something you want to take every day forever. The 5,000 I recommend is one of Dr. Collier's essentials. You take that every day. So anti-inflammatory like vitamin D, omega-3 fish oil does a variety of good things. Omega-3 fish oil is a natural anti-inflammatory for the body, but it also literally oils and lubricates the joints so they move better and don't cause a lot of inflammation in them. So those are two products that I highly recommend. Other things that you can get over the counter are other anti-inflammatories such as curcumin or turmeric. Turmeric comes in capsules, it comes in powders, it comes in teas. So many different formulations that you can get, but you just look for an anti-inflammatory or ask the pharmacist in a pharmacy or the grocery store. There's a whole section about things that. So turmeric and anything that has a pepper in it, red pepper in particular, is very effective for joint pain. So great question. Lakeisha Hogue, what's good if you have idiopathic urticaria and nothing happens? Okay, Lakeisha, the first part of that, idiopathic, that means we are too idiotic to figure out what the problem is. Urticaria is the big Latin word for hives. So if anybody has ever experienced a hive, that's an allergic reaction. The question is what? When it's idiopathic, which means we can't figure out what you're allergic to. It can be something as simple and elegant as a change in temperature. In other words, you're in a controlled environment, you're indoors, the air conditioner is set at 72 and you're nice and chill. You open the door and go outside, walk into your car, and the temperature is 90 degrees outside. Or vice versa. You leave the car outside, it's 90 degrees, you walk into the room and it's 72 degrees. That change of temperature can make some people break out in hives with excoriating itching from head to toe. I'm talking about overwhelming. But there are other things as well. It can be food. It can be just abrading. When a person has urticaria, I oftentimes would take their forearm and take a pencil and just write my name, Dr. Collier. Scratch it lightly with the rubber end of the pencil, or an ink pen that has not, where it's not the ink, just the tip of the pen, but no, not the ink ballpoint pen part. And so it lightly scratches the skin. Literally within 30 seconds to a minute, it will swell up and my name will be on their body. So this is absolutely incredible. It's easy enough to diagnose. The treatment would be antihistamine therapy. The most effective antihistamine, oral antihistamine for this is Allegra. Allegra or fexofenadine at a dose of 180 milligrams per capsule, which you can take once or twice a day. Once a day is usually effective. When a person is just starting and they have dramatic symptomatology, as you probably do, I have them take a stat loading dose, another one later that evening or that night before they go to bed, and then the next day, one in the morning, and if they needed, another one in the evening. But once you have the loading dose, one a day will probably be all that you need to control that. There may be some chances or some opportunities for breakthroughs that will just happen no matter what, because the histamine just builds up in your body and eventually it's got to release. But the vast majority of the time, you can control it with that. Sometimes it requires people to be on multiple antihistamines. So that's what's important. And then I recommend that you get blood allergy testing. That can be done with 1 drop of blood, not the scratch testing, because you're going to react to just being scratched, no matter what the allergen is in the needle when they're scratching you. So a blood allergy test, where they can literally take 1 drop of blood and test you for environmental allergens, grass, trees, and pollens, indoor allergens, cats, dogs, horses, moles and mildew in the bathroom, penicillin, and then various types of foods, everything from milk to eggs to shrimp, chicken, everything. All those are in that panel, and it absolutely, again, 1 drop of blood and no problem. So, Lakeisha, this is going to be a process. Once you have this diagnosis, you rarely can be cured of it, but you can control the symptoms. Control may also include something as dramatic as getting allergy shots, but you probably won't need to do that if you just take the Allegra as described. So there we go. Okay, Holly, for those who are just joining us once again, I want you to show them and bring up the website for them so everybody can see what the LipoDrop website looks like. Okay, so there you go. You see how you can address our videos and those sort of things. He's going to scroll through it. Okay. All right, Holly. Joining us right now, we have Dr. Collier's partner in crime. The medical A team is now back in place. Dr. Marlon Stinging B. Jackson, Dentures to the Stars, Atlanta's best DDS. Dr. Jackson, thank you for joining us again today.
My pleasure, Dr. Collier.
Okay, it's so good to see you once again. And so now we're going to open up the questions a little bit and if you have a dental question, if you have a question about your dental health, your oral health, when should you change toothbrushes? What is that on your tongue, on the back of your throat? Crowns, getting that $1 million Hollywood smile, implants versus bridges and dentures. Dr. Jackson is a wealth of information in doing so. So we're going to open that up as well. Okay, Holly, we can start rolling the questions again. Okay, Patricia Johnson, I'm 55, diagnosed with prediabetes, A1C is 6.1. I have high blood pressure, asthma, acid reflux, and a small cyst on my liver. I've been in menopause for several years now. What supplements can help? Okay, for the prediabetes, prediabetes is an inflammatory disease. And so Dr. Collier's 3 that we mentioned earlier, but we're going to restate that. Probiotics would be great for you in addition to vitamin D at a dose of 5,000 international units per day, omega-3 fish oil. But the probiotics will help amazingly address your asthma and your allergy problems. A small cyst on your liver is a benign thing. That's not cancer, and it won't become cancer. A lot of people have them. They just pick them up routinely sometimes when people get CT scans and MRIs for some other reason. Acid reflux will also be helped by the probiotics. Because of that, you also want to take the lipo-cleanse to keep that GI tract clear and doing so. One of the things that happens when you have acid reflux is that acid reflux can backwash and do damage. It comes up the back of your throat and do damage to your teeth. Dr. Jackson, how do you diagnose that and treat it?
Oh, that's a great question, Dr. Collier. Acid reflux usually occurs, or you see the signs of acid reflux when I do my comprehensive examination and I see something that looks like something has eroded something, like a little acid washout. Caries or tooth decay has one look. It's brown, it's cheesy looking. But when they have acid reflux, it's usually on the tongue side of the teeth, the teeth that are closest to the tongue. Mm-hmm. And it usually has a scooped out appearance. And, usually I ask the person, do they, have a lot of gas or do they burp a lot? Most oftentimes they'll say yes.
They do, yeah. People are not shy about that. They know exactly what's happening, particularly when they lay down. Sometimes they feel like they say my food is coming all the way up. And then you have that acidy, almost vomity smell in your mouth as well.
Right.
Okay, so those are the supplements that we recommend, Pat. Thank you so much. Okay, Princess Primetime Thompson. I'm a 58-year-old female with eczema. It really shows on my face. What are the natural things to do to help clear my skin and stop the itching? Eczema is a complicated disease, but it basically is nothing but an allergic response. And one of the things you want to do is keep that skin healthy is what you wash it with and what you moisturize it with. So Dr. Collier highly recommends a soap product like Dove for sensitive skin. I use a salicylic acid skin wash that, believe it or not, I buy from the Dollar General store for $1.25. It's $30 in any other store. It's the exact same product.
You got stock in those?
I do not, but I shop it regularly and I share it with the listeners. So $1.25 for salicylic acid. It'll say either facial wash or acne, ACNE wash, as well. Now, the soap and then the moisturizer. I like to use moisturizer lotions with vitamin D. One of the brands that I like because it's light and silky and very good for the face is Suave with vitamin D. Mm-hmm. There are other lotions, of course, things like Lubriderm, which are a little thick for the face, and expensive. So again, products like that, but how you wash it and how you moisturize it are clear. You should only use hypoallergenic makeups. That's for your base. That's for everything from your eyeliner to your mascara, anything you put on your face. Every one of those products should be hypoallergenic. Of course, that's an entire line called Clinique. The problem was they didn't have a lot of products that were matching the skin tones of African-American women. Now they do, because there are so many people and so many various tones, they realize they were missing out on a lot of money. But that's not the only one. There are many If you just ask for hypoallergenic, you sometimes go across brands. You like this brand of lipstick and this brand of eyeliner. So whatever that is, make sure you're only using hypoallergenic makeup products on your face, that you wash your face and remove all makeup at night before you go to bed. You don't really use a hard soap or scrubbing motion. Dr. Collier recommends highly the baby shampoo. There's no more tears, because when you start to clean, particularly around your eyes, the mascara and the eyeliner, as soon as the soap gets in your eyes, it starts stinging and you start rinsing. So you haven't removed it adequately. But with the no more tears, you can actually have your eyes open and it won't sting or burn. You can remove the makeup thoroughly in a gentle motion, not scrubbing aggressively, because scrubbing the skin aggravates the eczema as well. And then, again, a moisturizer before you go to bed. The biggest problem with eczemaceous skin is that it gets dry, it gets cracked, that makes it itch. You scratch it and it starts a cycle of inflammation. So the anti-inflammatories would be vitamin D and omega-3 fish oil as well.
I want to mention something that I use on patients that usually, especially when they have, herpes around the lip and whatever, is the vitamin E capsules.
Oh, yeah.
I use that on my face too, and it moistens without the greasiness.
And that's E, vitamin E, not D, vitamin
Right.
E. And you can buy a bottle of vitamin E oil this big. Guess where? The store where everything is $1.25. I got a bottle in my what do you call it, medicine cabinet at home. I use that as well. It's a great moisturizer. I'm glad you mentioned that, Dr. Jackson, because that is that's a great, very inexpensive, and you can use it on your hair. You can use it all over your body, head to toe. It is a great moisturizer and dirt cheap. Okay, great question. Okay, Erica Payne. Hi, Erica.
All right. Thank you for your comment, Miss Erica. Is the water flosser just as effective as dental floss? Well, that's a loaded question. You might want to ask the hygienist, because the reality of hygiene is that dentists do little hygiene. The experts are the hygienists. But to answer your question directly, usually we use water flossers have become effective because, a lot of people they don't have the manual dexterity to wind that floss up and do that daily flossing in between their teeth. So a water flosser is something that a person can turn on, put the water on. They might put some therapeutic agents in there to push the water through pressure to remove not just the food debris, but the pelican. The pelican is like a pre-plaque. And that plaque is that sticky film that you feel on your teeth when you first wake up in the morning. If you take your fingernail like that, you can see it. Well, if you haven't brushed your teeth in 2 or 3 days, you'll see a lot of it. All right. And smell it. But basically, whatever's going to help you remove all the plaque and keep the calculus down is good, Erica. So I have one at home, but I don't use it as often because you got to load it up. And when you use a water floss, if you're not careful, you dirty up your mirror.
Oh, yeah.
So, but it's a wonderful tool. I would recommend it. Thank you, Erica.
All right, Carolyn Brown.
Okay, Carolyn, can veneers be replaced if it falls off? Absolutely. In fact, let me just give a plug for the type of dentistry that we're providing today. We're in the era of digital dentistry. What does that mean? For people who have had crowns and partials and things like that, you know how the dentist or the assistant will take an impression and have it full of, it's like not good tasting dough, and they just shove it up in your mouth and you're almost choking to death because some of the material's going back there. Well, no more. They now have the type of digital dentistry where you sit there and we can scan your entire mouth. And it's so fascinating because you get to see everything: skin tones, colors, bumps, lumps, everything, how dirty your teeth are. But what it does, it creates a digital image, which allows you to have a permanent set. So let's say you lose one, as opposed to us taking that impression again, we'll call the lab, and say, Carolyn needs another veneer on number 8. How soon can you get it? They could probably get it to you within the week. So that's quite easy, Carolyn. Great question. Thank you.
Okay, so you said number 8. How do you count your teeth? I asked you this question before, and so I want to share this with the listeners. When you're counting the numbers on your teeth, where do you start? How do you start?
We start in the upper right. 1, 2, 3, 4, 5, 6, 7, 8. 8 is the tooth on the. If you're looking at me, it's the one that's going to be on the left side. But if you're counting on yourself, it's the front tooth on the right side. And then you cross over, that's 9. And you go 9 through 16 if you have all of your wisdom teeth. Down bottom starts again. Tooth number 17, which is a wisdom tooth. 18, second molar. 19, first molar. And it continues on. You pass the bicuspid teeth. You pass the eye teeth or the canines. And then you go into the central incisors at the bottom, right at the middle. It's called tooth number 24. Then 25. Then you go all the way on over to the bottom right, which is tooth number 32.
Okay, very good tutorial, because one of the questions that oftentimes perplexes a lot of people is the wisdom teeth are a part of the natural set of 32. They're not extra teeth.
No.
And that's what a lot of people have the impression, including me. I'm just a doctor. But that is amazing that how much information empowers you. So great question. Great question. Okay, next question, Ivy. Carletta Robinson, what does dizziness mean? Boy, that is a loaded question, because there's 2 types. There's dizziness and there's vertigo. And the basic thing is this. When you're feeling dizzy, do you feel as if you are spinning, or do you feel as if the room is spinning? That is the great separator. Right. That is a great separator in determining that. And then there's positional vertigo, which means you're here, you feel fine, you bend over like you're trying to clip your toenails or put on your shoes, and you get dizzy. So that would be positional vertigo. And right now, for whatever reason, I'm seeing a lot of patients with disabling vertigo. I had to write a note for a patient today that said she couldn't drive. They have to allow her to work from home, because she literally has had to pull over twice this week to stop, because she was unable to drive because she was so dizzy. So that is never had the problem before. Normal blood pressure, not having a heart attack or a stroke, but just dizzy. So this vertigo is a curse, because the treatment regimen is more tincture of time than anything else. We do treat it with antibiotics, decongestants, nasal sprays, but we're just throwing problems. We're throwing things at the problem and the symptoms. We're not really making a diagnosis. And if it persists, you'll get the $1 million workup, which will include a CT scan and the MRI of the head, which are negative 99.999% of the time. And so you'll leave with, I still have vertigo, but my CT scan shows I don't have a brain tumor. Okay. So, but most of the time, it just runs its course in a few weeks. But the treatment regimen will include a nasal spray such as Flonase or Nasacort, a non-sedating antihistamine, Claritin, Zyrtec, Zysol, or Allegra, and a mucolytic, in case the fluid in your ear is too thick to drain appropriately, Mucinex at their maximum strength. And that's the thing. The less expensive versions of Mucinex only contain 400 milligrams of guaifenesin. The maximum dose is 1,200. And the ideal treatment regimen is 2 1,200 milligram tablets or capsules twice daily. So if you're only taking 400 milligrams, you got to take 2 of those every 4 hours. That's a lot of pills, and most people don't do it. So spend a few more dollars and get the branded product that lasts for 12 hours. And depending upon your symptomatology, take 1 or 2 twice daily. I would do that, Carletta, for at least a week. If I'm seeing some benefit, that probably is the answer to the question. If it does not seem to fix the problem, then you need to be evaluated to make sure that it is not because of high blood pressure or heart arrhythmias or a variety of different things, because dizziness is just a symptom of something else going on in most circumstances.
I would like to add also, Dr. Collier and Carletta, that if you have your nasal sinus, it's called the maxillary sinus. There's an area called the osteomedial complex, which is the area where the mucus production kind of goes up. The nasal terminates, which is the little wind passages in your nose, And if it's closed up and everything's backing up and you have severe sinus obstruction, then that could possibly make you have dizziness problems too. You can tell if you have sinus issues a lot by just literally bending over and kind of putting your head down below your knees. And if you feel that pounding pressure, that could be something also. But
and that's a clear indication that you may need, quote, sinus surgery. But I think sinus surgery is oftentimes overdone. But if you have that pressure sensation, Dr. Jackson just gave you a good little home evaluation you can do yourself to determine whether you actually need that surgery. Because I get a lot of patients who, when they go to be evaluated, surgery is suggested. And I tell people, I say, if you go to a doctor that is a surgeon, guess what he's going to suggest? He's going to suggest surgery. And so sometimes your non-surgical options are always your first options, and then surgery is your final option if you have not responded to any other treatment options. Okay, great question. Olivia Moody, 72 years old. I'd like to go. Go ahead.
Go ahead, Dr. Carter.
I'd like to get dental work done, which involves extraction of remaining 7 top teeth. I have bone loss and would like to get the new dentures, which appear to be the type that is of a soft mold rather than implants or the acrylic. All right, she's educated. What do you think would be best for me?
Well, that's that would really require a consultation with you, Olivia, because what the dentist has to determine is a number of things. What are your expectations? Are you a low expectation person? Do you want just something in your mouth? Or do you want your mouth? Are you concerned about you want to have the best smile or what kind of job you have? Do you have a gag complex? Because sometimes people don't understand that when they take teeth out, that is an irreversible decision. And the only thing that you can put in when you have no teeth, the most economical thing to put in there is a denture. Well, when I tell people, okay, you're tired of your tooth problems. Well, good. Let's get some dentures. Now you're going to have denture problems. All right. Denture problems are like this. And I tell people, I try to sway them. Okay. You get what you pay for, in other words. All right. When you get a denture, you're getting teeth, but you're also getting extra gums and a bulky material that's going to cover the roof of your mouth. The roof of your mouth. You don't understand what that means until it's in your mouth. And then your tongue, which is a very territorial organ, it knows every part of your mouth. And it loves space. It likes to move around. You put a denture in, and you're depriving that tongue of not only freedom, but talking. There are taste buds at the roof of your mouth. And you cover that up, you don't taste your food as well. All right. If the denture is ill-fitting and it moves around, you're trying to eat something like almond nuts or peanuts or a nice steak. You got to cut your steak into little bitty pieces, or chicken or whatever. But the thing about it, a denture experience is, if you've never had it, you have to really consider it, because what we have to tell the patients is your expectations need to be lower. You can't come in and say, okay, I got these teeth and this is not right, that's not right, it's moving around. Well, a denture is removable. So, but I'm not going to bad talk a denture. It's better than nothing. But we just have to make sure our expectations are aligned. And that's what I like to do with a lot of my patients when I give them treatment. I don't just try to rush them to have treatment. I have to try to give them the best, find out what their budget is. I know they talk about insurance, but let me tell you a secret. Real dental care is expensive. No. Insurance does not cover the bulk of your dental insurance. Either you're going to have to come from your savings, or you're going to have a financing plan. And guess what? If you get a good, like I said, fixed work, like implants and crowns over them, and you get it financed, and you say, okay, that's a lot of money. Well, you're paying for your car note, that you only use your car 3 hours a day. You got a house note, and you're probably only in that, depending on how far you are from work, 8 hours a day, maybe less. So, but your teeth are with you 24 hours a day, 7 days a week. That's why putting your money where your mouth is the best investment you can do. Thank you, Olivia.
That was very elegant, Dr. Jackson. I really
you got me warmed up. I've been in practice
that.
40 years. I can't wait to tell the listeners. I'm just in a good place. When you've been practicing 40 years and you still have the same zest, the joy, the knowledge to want to do and make people happy, that's a good thing.
That's a good thing.
The Creator blessed me, and I'm glad to be here. And guess who helped me be here? This man right here. All right, thank you, Dr. Kai.
Thank you, Dr. Jackson.
Next question, please.
Okay, Dr. Kai, I want to know what can I take to regulate my hormones and rid the stomach parts because I work out, but nothing is working. So, Tracy, let me tell you a little secret. Particularly for women, as you age, your estrogen level goes down. One of the benefits of estrogen is it directs fat and fat deposits to your thighs and your hips to support the growing baby. But guess what? When you get older, you're not having a baby anymore. Your estrogen level goes down. And so now fat is being directed to your abdomen. So that is why women get a pouch as they get older. And it doesn't matter how many crunches you do, how much exercise you get, you're going to have that pouch. It is a neurohormonal response. And so to do that, you need to address the hormonal issues. Now, one of the things that we benefit, and we say this, is lose the muffin top with lipo drops because it allows you to lose weight from places you cannot traditionally exercise it away from by altering your body's response in the way that you metabolize fat. So that is a good thing. It allows you to metabolize fat and lose fat from places like under your chin, the back of your arms, along the bra line, and of course, pinching an inch, lose the muffin top with lipo drops. But to that in combination with bioidentical hormone replacement therapy, even traditional hormone replacement therapy. But if you're going to do the best and do it right so that you get optimal benefit. BHRT, you can Google that, is one of the greatest things that has ever been invented for longevity and looking good. Not just living long, but looking good as you're living long. And this is for men and for women because it literally does an evaluation of your body's neurohormonal system. It allows you to replace just those things that you need and you have deficits in. It may be one thing, it may be 20 things. Whatever it is that you need, this assessment allows you to correct. It is literally the fountain of youth. And so when you do pellet therapy, which is what I'm speaking of, is where you implant pellets in either the abdominal wall or into the buttock area just above the sitting area, it will be life-changing. That will shrink that abdominal fat. That will increase your muscle mass, decrease your body fat, but also make you sleep better, improve your attitude. You become the alpha male or the alpha female that you used to be because you are who you used to be many years ago. So search bioidentical hormone replacement therapy. Find a provider near you. It is a service that Dr. Collier provides here in my office in Atlanta. But if you're not local, I'm sure there are providers there. I literally have people fly from all over the country to get this therapy when they can't find a local provider. But it's also one that it's become more popular. More doctors know how to do it. So it's readily available now. So one of the things you want to try.
What age or condition do you suggest a person start thinking about?
You can start thinking about BHRT as young as 40 because you start to lose your hormonal status, particularly men in their 20s. In about 30, that decrease of testosterone, and every decade you lose more and more. For a woman starts to gain about 1.5 pounds per year, starting at about age 30. And most of it goes straight to the abdomen. And so, women who before it's not the mommy body per se, it's not the children that do this, it's Father Time that does it. So you can't blame your children for your stomach. It's not them. It's Father Time that does it. And over time, like I said, you say, 1.5 pounds, that's nothing. But after 10 years, that's 15 pounds. So what was good at 30 is now a little chubby at 40. And at 50 now, you got a full-fledged stomach going on. And that will continue as you age because you cannot stop this natural process that goes on. So it's very important that you can correct it. By bioidentical hormone replacement, you can adjust it by our products like our Lipo Drops maximum strength formulation that will take away that belly fat, along with, we have the new Lipo Nights product as well, which allows you to burn fat while you sleep. And the point being, you lose fat from the places that you have fat. And if your stomach is a place that your fat is being disposed, then that's where you will lose it from. It's a simple scientific phenomenon. It's what happens. So go to the website, lipodrops.com, look at those products, and they may be the answer to your question. If you want further information on the bioidentical hormone replacement therapy, you can DM me on all social media at AskDrMJ. Ask Dr. MJ. Okay, great.
Let me ask you
or you can reach me through the Lipodrops website as well.
This might be interesting. Maybe it might be another subject for another broadcast. But we have this, we're in the era of the BBL, when they're getting the replacement and enhancement. How does the aging product help that or hurt that? And how does the BBL age over time? What is your speculation of how that's going to work?
As you can see, because now we're getting to the point where a lot of people that got the BBLs, particularly the early adopters, now they're 10 years in, they're 15 years in. And so they are aging. And guess what? That flat stomach that they had lipo sucked out is now no longer fat, because Mother Nature will not lose this battle. She says estrogen is down, so we're putting fat in the stomach, and done it. That's where it's going. And so you probably have a friend or a family member, or maybe even yourself, and you say, oh no, I'm gaining the weight back. People want to revise them or do them over. I see this all day, every day in my practice, and a lot of patients that reach me through social media will ask that question. That is not a failure of the primary surgical procedure. It is a progression of the procedure's process, which is the aging process. You just cannot beat that. And so you either have to keep getting it done, or you just say, okay, believe it or not, you don't have to have a concave stomach. That is not the natural look for a woman. It's nice and natural for a woman to have a little pooch there. I think most men actually like that.
Yeah.
But because most of us actually have one too. So that's good, and that's the way we are. Okay, next question. We got time for a few more. Okay, what experience do you have with an alkaline diet? How long before your alkalinity changes? More so, alkaline water would be the key there. There are alkaline foods, but water is the quick method. And you change it almost if one glass of alkaline water changes your body's pH. And so if you continue to ingest it, this is a very positive thing. It will allow fat metabolism, make you lose weight. It has a lot of benefits that are real, and a lot of them that are perceived. But it's something that Dr. Collier will I won't necessarily endorse, but I'll say people do it and they seem to benefit from it. I was at the point one time of thinking about getting an alkaline filter for my home after looking at some of the benefits of alkaline water, but it was so expensive that I said I can just go to the Kroger or the Publix and buy alkaline water by the gallon. That would be the way to do that, but it helps with everything from digestion to your complexion.
Or you go to the pet store and get some of that alkaline up. No, I'm just joking.
That's the same thing that people think. Until I became a dog owner, I didn't know that 90% of the antibiotics they have for the dog at the veterinarian are the exact same thing I prescribe in my office as well. I said, you can give this to a dog? Who knew? All right, next question. Okay, Chelly. Is that Chelly? Chelly asks, if you're missing it, go ahead.
If you're missing the tooth in the back and the tooth above it moves down, is that bad? Is it really necessary to get an implant? Chelly, excellent question. People, when they usually a person gets a tooth removed for one of the following reasons: a toothache, periodontal disease, or some kind of trauma of some kind. Well, when you remove a tooth, the first thing that begins to happen, some people it happens in accelerated fashion, some people insidiously, but the tooth begins to shift and drop down. And when it drops down, basically you have like your teeth are kind of like, they're miracles. They're when they're aligned right, everything is straight and nice. And what we're looking for is that the zipper effect. And what happens is when you have a tooth missing, the tooth begins to drop down. It changes the alignment. It opens the space up. You get food caught in between there. And it also, when you finally want to have a tooth replaced at the bottom, it becomes a problem because that tooth is there. So either you have to have it out or you have to have a root canal crown. But a lot of work that could have been avoided if you would have tried to get the work done on that tooth that was involved. If you have a tooth and it needs to come out, yes, try to get an implant as soon as possible or some kind of replacement so you prevent the migration of the other teeth. Excellent question, Shelley. Next question, please.
Okay, we're going into OT right now. Ken Bridges.
All right. Thank you, Ken. What causes tooth sensitivity to both hot and cold? Well, usually tooth sensitivity can occur from a number of ways. One is the most common way is people do not brush and floss daily. Okay. And if you allow the plaque and calculus to accumulate on your teeth, that eats away the protective layer of your teeth, causing sensitivity. Another reason of sensitivity is just the aging process, even affects myself. When you age, either through toothbrushing or whatever, you cause what we call your teeth, you have what you call a recession. Your teeth begin to recede and your teeth look longer. And what's exposed is the root, which causes sensitivity. So what do you do about it? Well, get your teeth clean for once. If you have super sensitivity, most dentists can apply a chemical or varnish that can reduce it, but you have to do it probably every 6 months or so. Sometimes you may need a filling. If it gets real bad, you need a root canal. But great question.
I can say unequivocally that the hygienist at the Dr. Jackson's office just did that procedure on me last week. And because I went in there for something totally different. And I just casually mentioned, she said, well, how are your teeth? And I say, totally sensitive on the entire side, the bottom side, every tooth. I say they're not infected, inflamed, or whatever. They're just very sensitive all of a sudden. They just reached the threshold, I guess. And boy, she worked some magic. And by the time I left out of there, they were amazing. And I wouldn't have had a steak the next night. And you know, there was no restriction. I could have eaten it that night, but I did not. But that procedure was amazing. So make your dentist your friend. Don't go in when things are bad. Go in for routine maintenance, just like you take your car in. It helps tremendously as far as your long-term dental health is concerned. I've learned so much. I've always been told that you should brush up and down. I grew up doing that. Then I learned in my last dental visit, I should brush in a circular motion like I'm getting a massage. I'm like, wow, okay, technology has changed. We always talk about how often you should change your toothbrush, every 6 months or 3 months.
I would say at minimum probably 3 months, or if you get a cold or like you said, the latest virus going around, as soon as you get over it, toss the toothbrush.
Yeah, as soon as you get over that. Matter of fact, sometimes I'll switch when I get sick, and then at the end of the illness, switch again, because you basically, a lot of people will reinfect themselves, especially with something bacterial like strep throat or whatever. It become a chronic thing because that toothbrush is just contaminated. You can't clean that toothbrush, so it's just best to just throw it away. But I did find also the most effective, bar none, treatment that I have used is saltwater gargling.
Yes.
Dr. Jackson told me that before the last broadcast, and boy, I've been doing that. It's better than this very expensive mouthwash I've been using, but it also makes my teeth, my gum, and my throat feel amazing. Yes. And I just take 1 teaspoon of salt in a warm glass of water and just gargle to my heart's desire. He said you can do it 4 or 5 times with a full glass of water, as many times as you like. So that's my regimen. After I do it first, then brush my teeth, and then after I finish brushing my teeth, I continue to do it between segments like shaving. Other things I do, you know, putting my hair on and all that stuff. I do that and I gargle the entire time. So that is absolutely incredible. Okay, so look, this is going to bring to a close this episode of the Your Health is Important Ask Dr. MJ radio broadcast. And we are so glad that you chose to join us tonight because you have choices and options. Once again, the first post daylight saving time broadcast, we had the benefit of being blessed with the presence of Dr. Marlon Stinger B. Jackson, our dental expert and my personal dentist. And again, Atlanta's best DDS. He's been in practice for a long time. I never would have violated him by saying more than 20 years, but he was happy to share that information. So we look forward to seeing you next time. And remember, you can see us on all social media at AskDrMJ. We are on Facebook. We are on Instagram. We are on TikTok now. And we are on YouTube. So tune in, watch these videos. You can rewatch this one. And more importantly, tell your friends. Yes. Don't just keep this a secret. Don't say, well, I'm going to go get great medical and dental information tonight.
Free.
Friends, tune in. Tune in. Say, I'm watching Dr. MJ tonight. You need to tune in too. And go to our website, lipodrops.com, where you can get more information on supplements that will enhance your healthcare status. Thank you once again. We'll see you next time.